Now, as we observe Women's Month, let's talk to people opposing women abuse about the link between alcohol and gender-based violence. Is there a link between the two? Mary Makgaba is with us. She's from POWA to talk to us about this issue. Mary, good morning. Thank you very much for your time. Have you found that there is a direct link between alcohol abuse, or the harmful use of alcohol, as some scientists are calling it, and the rise and increase in violence against women?
Thank you for having me. Yes, I wanted to make an indication that there is a strong relationship between alcohol use and gender-based violence. In fact, alcohol abuse perpetuates gender-based violence. There are risk factors that I can say that are associated with alcohol intimate partner violence. I can say there is some evidence that heavy drinking or frequent drinking, particularly by males who are mostly perpetrators, increases the risk of violence. In one study, if I could cite an example, a woman was forced to have sex in front of her children because the man was under the influence of alcohol. Heavy drinking, of course, yes, increases aggressive behavior, lack of control, and increases the risk of committing acts of domestic violence and sexual violence.
Now, currently, Mary, we have this ban that the government has imposed under COVID-19 regulations. There's a lot of discussion that's been happening, and there are calls for the alcohol ban to be lifted. What would be POWA's view?
In terms of POWA's view, we don't support for instance, the lift of alcohol bans, because remember, if we can give reference, if you look into the level 5 lockdown when it started, when the alcohol was banned, people didn't have access of buying alcohol. You know, the stats went down in terms of SAPS and in terms of hospitals for alcohol-related incidences and acts. I could say that as an organization, we don't support it because it increases the likelihood of having more GBV cases to be alarming and to be on the spike. As a POWA, people opposing women abuse, we don't support the lift on the ban of alcohol. We are saying they should not open access to get alcohol.
Yeah, as part of my program. Yes, continue.
I just wanted to say, remember when a person is under the influence of alcohol, it affects the psyche and the mind of a person, cognitive thinking, and reduces self-control. That's why most perpetrators, they end up engaging in sexual behavior, committing coercive sex, rape, and engaging in multiple relationships, having multiple sexual partners, also increasing the high risk of HIV because they don't normally use condoms when they are under the influence of alcohol. We don't support it as people opposing women abuse because we know that our women will get more and more abuse, especially physical abuse and sexual abuse.
Yeah, we'll be discussing this for most of the next hour, Mary. I'm going to be joined by other panelists later on, and hopefully you can stay for that as well, because there are calls that are going on currently for a relaxation of sorts, and we are asking our viewers current on our website, enca.com, if they believe that government should lift the ban on alcohol. You as POWA, you are very, very clear. From evidence, you are talking, I guess, anecdotally, but the numbers from your experience as POWA, have you seen a rise in calls for support from POWA, for example, and other organizations that support women at this time? Since there was that short while, where for a few weeks or so, that there was a relaxation of alcohol sales under lockdown level 3?
Yes, thank you, because remember when we admit victims and survivors in our shelters or in our offices when we provide counseling, in one of our questionnaires and intake, we ask them questions pertaining to alcohol. Normally, our responses from them will get responses like, a man, when he's not under the influence of alcohol, is a better person. He's very understanding. He can listen to you. But when the person is under the influence of liquor, that's where domestic violence becomes alarming. We are working with other civil society organizations like ADAPT because they deal with men. As people opposing women abuse, we mostly deal with women and we assist victims in particular. But we do support programs of men. We partner with such kind of organization to ensure that we empower men as well through those kind of partnerships.
Okay, Mary, I'm going to ask you to stay connected and don't leave us, because later on I'm going to make you part of a panel discussion with other experts, including a health expert and somebody from the liquor industry. We can continue having this discussion. It's a very important one to have, because calls are growing for the ban on alcohol sales to be lifted, but voices like yours need to be heard.